My name is Brooke. I graduated from high school in 2019. I'm finishing with my associate's degree at Salt Lake Community College this week, actually. I'll be going to UVU in the fall studying psychology, and I'm planning to also at the same time get a degree in substance abuse disorder counseling. And I have a dog named Hank. He's pretty awesome. He's a mini Australian Shepherd, and I love to run and mountain bike. So my primary care physician initially suggested it about a year and a half ago, and initially I was pretty apprehensive. My dad also was probably a little bit more hesitant even than I was, and so initially we put it on the table and tried a few more different options. I've had quite a few concussions, so I've struggled with mental health as a result. The last 4 specifically that were more difficult was I got 4 in a period of 6 months playing soccer. That was my junior year of high school, and not allowing your brain to fully recover before the next brain injury really did a number on me and caused a whole series of other medical issues following. It's definitely been a journey. That happened when I was 16. I'm 20 now, and so it's been a journey, and initially ketamine was this big scary thing. I really wanted to be sure that it was something that I felt ready for. And so about a year later, so in October of this year, my primary care physician brought it up again, and I felt a lot better about it this time, at least to find some information out. And so that's when I got to talk to Caden here at the clinic, and we had a pretty good conversation. I had lots of questions to ask. And I just felt really good about it. I all of a sudden didn't really feel like it was this big scary thing. It was something that there's been a lot of studies on and about the efficacy of it overall. And also too the potential for it to be able to help me. It's not really like other doctor appointments. You walk in, they ask you if you want a blanket, an eye mask, and then they see you to your room. From there, normally the nurse will come in and they'll take your vitals, and then they'll get an IV going. Your provider will then come in and they'll talk about dosages, and also they always talk about how the last one went, which I think is important because you never really know how those go. And so once you kind of talk about that, you solidify if we're going to push nausea medication extra or whatever else you need. The first 2, I noticed a bit of a difference. My body was lighter after, and things that I maybe didn't even realize that I was stuck on mentally, and kind of some things that I've been through in my life, I realized how much of an impact those had on me, holding me where I was in kind of this cycle of mental health struggles, of depression, of anxiety. And then coming out of those sessions, I think in a way I was able to kind of go inside myself a little bit and reanalyze of who am I with no one else in the room, and what do I want, what are my goals. And then after doing that, to then be able to re-go through some things in my life that I have been through that are maybe a little more difficult, that I may not talk about all the time, and to be able to analyze those, but not from my perspective. It was almost like it was from another perspective, which made those instances in my life seem smaller. It made them seem more manageable, and it made me feel more capable to deal with things that happen in my life. So although it obviously doesn't change anything that's happened or the trajectory of my life, I still get to choose that. I think it allowed me to change my mindset on a lot of things and break out of this cycle. So 1 and 2 were really empowering and really cool. But 3 and 4 too, I would say the days after, I just had a little bit of a hangover in the morning. I didn't feel awesome. Number 5 and 6 though, it just took me a little bit longer as they upped the dosage to be able to come out of the trip itself. But I really do think it was tiring. It was a lot. It's 2 every week for 3 weeks. And I'm in school and I work full time. So at first I wasn't sure if I'd really be able to deal with the busyness of my schedule and then to add this on top of it. But I've noticed a huge difference just in that I'm able to be more present. I don't feel as into myself, into my emotions, into what's happened in the past, and I feel like I'm able to better focus on where I'm moving in my life and where I want to go from a mental health standpoint, from just my life in general. So that's been really empowering, and when I walk into a room now, I'm not so sucked into me. I can focus on others. I feel more capable to serve other people, to just not be so stuck where I was for so long. I'm able to focus more in a long-term perspective, especially when things get hard. I think people who have struggled with mental health understand that when you're in it, and it's hard to see outside of that moment, outside of that day, outside of whatever you're going through. And so now to be able to take the hard days as they come, because obviously things aren't perfect and I still have hard days, but to be able to be in that hard day, but to know that better days are coming and that I'm capable to be able to get through whatever I'm going through has been empowering.